And that, my friends, is how America was made great once again. Breaking at this hour, Jimmy Sengenberger is currently at the crossroads of politics and economics. Radio broadcaster master, now the celeb on the web. He's the smarty of the party. He's in cahoots with the grassroots. Jimmy at the Crossroads brings you thought-provoking commentary, hard-hitting interviews, original satire, and the best bumper music known to man. Jimmy at the Crossroads!
Gonna talk money, gonna talk politics. Great for all generations. Oh, what a great mix, I said. Gonna talk money, gonna talk politics. Great for all generations. Oh, what a great mix. I got Jimmy at the Crossroads, making sense out of nonsense. People want answers, they want to understand. They come to the crossroads and Jimmy gives them the plan. I said, gonna talk money, gonna talk politics. Great for all generations. Oh, what a great mix. I got Jimmy at the crossroads, making sense out of nonsense. Come on, Jimmy, what you got?
And now, ladies and gentlemen, live on the set, it's Mr. Sang Style, Jimmy Sengenberger.
Nathan Matoush working the Matoush magic as producer extraordinaire today. I want to jump right into it. Yesterday, President Donald Trump announced that he has a plan to reopen the economy that relies largely on the states. Let's play Cut 5. Donald Trump, President of the United States, at his press conference yesterday.
Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states. Every state is very different. They're all beautiful. We love them all, but they're very, very different. If they need to remain closed, we will allow them to do that. And if they believe it is time to reopen, we will provide them the freedom and guidance to accomplish that task, and very, very quickly, depending on what they want to do. We are also encouraging states to work together to harmonize their regional efforts. We'll have numerous cases where states have worked and will be working very, very closely together.
I'm Jimmy Sengenberger. Welcome to Jimmy at the Crossroads. So President Donald Trump yesterday making his announcement that he wants to reopen the economy and relying upon the American people and their states taking the initiative. Now, this is interesting because a few days ago, President Trump was saying in public that it was his view that he has total authority as president in this matter. And the media went apoplectic. I criticized the president the other day. But as a couple of guests pointed out here on Jimmy at the Crossroads this week, it really was the case that what President Trump said about total authority was a complete contradiction of the policies that he's actually been using. The policies that he has taken into effect over the last month and a half have been geared towards the states and federalism and letting the states take charge. He has resisted any calls from some, including within his own administration, to institute a nationwide quarantine. So this is entirely in step with his policies. His statement the other day was out of step with what he's been doing. Yet CNN seemed to hype this up. Take a look, Cut 6. This is Jim Acosta on CNN just yesterday.
That's right, Wolf. This is a total reversal from what the president was saying a couple of days ago when he was saying he had the total authority to dictate to the governors what they can do in their respective states. The White House is not clinging to that position anymore. I talked to a senior White House official who said that these guidelines are simply that, guidelines, guidance to these governors to determine what is best for them, and that ultimately, according to the senior White House official, it's going to be up to the governor's discretion as to how to reopen their states.
In complete reversal, did you see the headline there underneath Jim Acosta as he was reporting for CNN? In complete reversal, Trump leaves it to the states. Now, I can understand that's a reversal of his statement, but not a reversal of policy. Therefore, certainly not a complete reversal. But they're trying to hype it up in this way and basically say, hey, this is the way that President Trump operates. It's fly-by-night operation. He changes his mind day in and day out, and there's no sort of coordination or cohesion. And that's what a complete reversal supposedly highlights. So it was a misrepresentation of how President Trump has been approaching this. And it's unfortunate, but that's the way that the media conducts itself. Now let's go to cut one. This is Dr. Deborah Birx yesterday. Of course, she's the coronavirus response coordinator for the Trump administration. And she talked a little bit about some of the things that through all three phases. So let me take a step back. Yesterday, the Trump administration announced a three-part, three-phase reopening of the United States of America, especially the economy. But it's not just economy, it's also our society at large. So Dr. Deborah Birx laid out the different components to what she's what the administration is doing. And specifically here in this clip, in cut one, she lays out some of the guideposts for the administration step by step from start to finish for all three of the phases.
You'll recognize this slide is what we've been talking about in the 15 and 30 days to prevent the spread. It's continuing those critical hand washing or sanitizers, not avoiding touching your face at all times, disinfecting surfaces, using face covering while in public, following state and local guidelines, and critically staying home if you are sick. I know a lot of people go to the workplace when they are feeling ill. You know when you're feeling ill. It won't get better by going to work. So we're asking again for people to stay home when they're sick. Next slide is for employers to ensure that there can be social distancing and protective equipment, temperature checks, use of disinfectant in high traffic areas, including break rooms, and ensuring that we don't do there's no non-essential business travel, and then monitoring for any symptomatic individuals in the workplace. And again, if you become ill at work, to immediately to go home. And ensure that there's contact tracing of all the individuals that become sick.
Again, guideposts for all three phases of what the Trump administration wants to move forward with. And again, these are all guidelines for the states. As the president has reiterated now, it is up to the states. The onus is on the states to take the ball and run with it. But the CDC, Center for Disease Control, and the Trump administration and the White House are providing the guidelines. Here are things that you should keep in mind. Phase 1, Phase 2, Phase 3. Just as a teaser for what we've got coming up with our guest for this abbreviated edition of Jimmy at the Crossroads on this Friday, April 17th, let's play cut 2, which is Dr. Birx describing the most intricate, I would think, I guess all three phases are kind of intricate in how they're approaching it, but phase 1 of the Trump reopening plan.
Phase 1. Again, you have to go through those gating criteria related to 14 days of decreasing evidence of illness and decreasing testing despite adequate testing. So phase 1 begins with all vulnerable individuals, including those with comorbidities, continuing to shelter in place, and ensuring that those that first go out into the public are not those that are most vulnerable to bad outcomes in this disease. And then ensuring that we continue to do 6 feet maximum physical distancing in public spaces, continuing to avoid large gatherings, and all non-essential travel. For the employers, next slide. Again, if a vulnerable population needs to return to work and cannot be teleworking, there should be special accommodations for all vulnerable populations, as well as options for teleworking. We believe every employee should encourage work return in phases, from 20% or 25% to 40% to 50%. And again, minimize all non-essential travel. Phase 1 continued. Next slide. If the schools are already closed, they should remain closed. All visits to senior living facilities and hospitals should continue to be prohibited. Large venues, including sit-down dining, can only be operated under strict physical distancing protocols and maintaining those 6 feet. Gyms could open if they, again, could adhere to strict physical distancing, and elective surgeries can resume on an outpatient basis.
Elective surgeries can resume on an outpatient basis in phase 1. So the Trump administration are really trying to roll out guidelines piece by piece, slowly over time. We'll see how slowly that lasts, but doing what they can to say to the states, here are some guideposts. We think that if you follow these, you will be able to reopen effectively. I'm Jimmy Sengenberger. You're watching Jimmy at the Crossroads. We're going to take a quick video break here on the show, and when we return, we will talk with Dr. Dennis Deruelle, medical doctor, author of the book Your Healthcare Playbook, Winning the Game of Modern Medicine. He is a hospital doctor expressly and a physician, a practicing hospitalist, that's the title. And we're going to get his thoughts on the medical side of reopening and the strategy of reopening America. Is this the way to go? So keep it right here. We've got Dr. Dennis Deruelle coming up on Jimmy at the Crossroads, coming to you in partnership with the Washington Examiner.
Who's there? What do you want?
Hello, Don Trump. It's me, the Easter Bunny.
Have a seat, have a seat, have a seat so much. Do you remember, Easter Bunny, when I did you a huge favor by eliminating those horrible carrot tariffs?
Yeah.
Well, now guess what? You're going to do me a huge favor by doing your normal Easter Bunny thing, whatever that is. Running around the world, planting eggs in the ground, but America first, please.
Okay, a couple of things. First of all, I hop around the world. I don't run. And second of all, I don't plant the eggs. I just hide them.
How do they come to full maturity then?
Well, you hard boil them.
That seems a little cruel to me. I don't,
Well, I'll tell you what you can do. Why don't you just pardon them like you do the Thanksgiving turkeys?
It's a different thing.
The third thing. How am I going to get around the world, Mr. President? The travel ban's in effect. There's TSA to worry about. I mean, I got to get...
Consider it done. Consider it done. I'm going to use the War Appropriations Act to commandeer Santa's sleigh.
Good idea.
And there's nothing he can do about it.
Well, he might not...
Oh, you're worried about his elves.
The elves, yeah.
Believe me, if they raise a stink, it's going to be boom, boom, out go their northern lights, believe me.
Oh, that seems kind of harsh.
Now, tell me something. When you hippity-hop out of your tomb...
That would be Jesus.
Every year. And you see your shadow?
That would be Puxatawny Phil, the gopher.
That means there's 6 more weeks of the quarantine, isn't that right?
That would be Dr. Fauci.
You know something very interesting? The Easter Bunny. Most bunnies leave only white eggs.
There's only me, sir.
And that's wrong. I'm the least eggsist man you'll ever meet. This year we're going to have all the colors of the eggs everywhere, every stripe. A panoply, a panorama, a rainbow of colors.
Yeah.
I want it to look like Walt Disney himself threw up.
Thanks for that visual. I think I can make that happen. Let me call my peeps. We'll get around the world before you know it, and Easter Sunday's going to be great again. Oh, and this year, Mr. President,
yes,
just as a favor, I promise not to smoke all the Easter grass.
That's a very good.
That's a little joke I got from Colorado.
I'm going to tweet that one, actually.
I'm out of here.
I'm
Hopping
tweeting it
over.
right now. Here I am. Oh, by the way, when you get to heaven, say hi to Half and the bunnies for me, please.
I really don't think that's the way it works, Don Trump, but I'll see what I can do.
Census Bureau, I need to take your census.
Aye.
All right, let's get started. Can you identify yourself?
Yeah, this is me.
When is your birthday?
September 15th.
What year?
Every year.
Race?
Republican.
Is this a house, an apartment, or mobile home?
Mobile apartment.
How many people are living in your home?
2.
How many people are not living in your home?
Approximately 7.8 billion other people. Minus 2.
Please identify all that apply. Samoan, Geneva, Milano, Brussels, Neapolitan, Danish?
Thin mint.
And finally, would you like to be a donor?
Oh, sure. Tonsils, toenails, and elbows.
America's politics are crazy. The culture is in flux. That's why we work hard to help you keep up.
More politics, more culture, and more access.
We focus on the biggest stories of the day with some of the biggest names in politics and punditry.
Go to our website, WashingtonExaminer.com. Subscribe to our YouTube channel. Be sure to follow us on Facebook, Twitter, and Instagram.
All right, ladies and gentlemen, let's welcome back Mr. Sang Style. Back to the set, Jimmy Sengenberger.
Grooving back on Jimmy at the Crossroads. Such a pleasure and a privilege to be with you on this Friday, the 17th of April. Thanks for joining us, being a part of an abbreviated edition of the show, but one that we think will be insightful nonetheless. Coming to you in partnership with the Washington Examiner and bringing you engaging, intelligent talk, Sang Style. Thanks so much for joining us, being a part of the program. By the way, if you haven't subscribed yet on the YouTube channel, please do, youtube.com/Jimmy at the Crossroads. And then also, Jimmy Sengenberger Media Personality on Facebook is the place to go, the Facebook page, where you can watch live as well as on YouTube and get the various video content that we have out there. And be sure to follow our friends at the Washington Examiner as well. So in the last segment, we talked a bit about the Trump plan to reopen the American economy. And not just the economy, but America altogether in terms of the society, in terms of the social relationships, family connections, somewhat gathering together over time with phases 1, 2, and 3. Let's go ahead again and hear in cut 2, Dr. Deborah Birx talking about the first phase, and we will introduce our medical guest.
Phase 1. Again, you have to go through those gating criteria related to 14 days of decreasing evidence of illness and decreasing testing despite adequate testing. So phase 1 begins with all vulnerable individuals, including those with comorbidities, continuing to shelter in place and ensuring that those that first go out into the public are not those that are most vulnerable to bad outcomes in this disease. And then ensuring that we continue to do 6 feet maximum physical distancing in public spaces, continuing to avoid large gatherings, and all non-essential travel. For the employers, next slide. Again, if a vulnerable population needs to return to work and cannot be teleworking, there should be special accommodations for all vulnerable populations, as well as options for teleworking. We believe every employee should encourage work return in phases from 20% or 25% to 40% to 50%. And again, minimize all non-essential travel. Phase 1 continued. Next slide. If the schools are already closed, they should remain closed. All visits to senior living facilities and hospitals should continue to be prohibited. Large venues, including sit-down dining, can only be operated under strict physical distancing protocols and maintaining those 6 feet. Gyms could open if they, again, could adhere to strict physical distancing, and elective surgeries can resume on an outpatient basis.
Again, that's Dr. Deborah Birx at the White House press conference yesterday explaining phase 1 to the 3-phase plan to reopen America from the Trump administration. Let's talk about this, particularly from the medical perspective, with Dr. Dennis Deruelle, MD and FHM. He is a physician and practicing hospitalist and author of Your Healthcare Playbook, Winning the Game of Modern Medicine. Dr. Deruelle, welcome to Jimmy at the Crossroads. It's so great to have you on this Friday.
Sure.
Thanks for taking the time. Really appreciate it. So, fundamentally, how do you see things as being at right now in terms of the coronavirus crisis and how it's being handled? And are we ready for a 3-phase rollout of America in this grand reopening of sorts?
Well, I think that we were slow on the uptake. I do consulting for a company called Cepheid that was developing a test for this. They interviewed me on February 11th. They asked if they should go on and develop a COVID test. I said, of course, yes. But if you think about that, that was February 11th. So I think that our testing was behind, and I think that our distancing was probably behind. But today, I think we've caught up to that. So if I was judging now, I'd say we're now at a B. We were probably at a C- when we started this thing.
So then, ready if it's rolled out in a slow three-phase fashion like the administration is proposing to states?
Yeah, I think that the key thing is that there's a gating criteria. So, the phases are one thing, but until a state has certain things in place, first of all, they have to track influenza-like illnesses, which are really COVID illnesses, so they're the same. And you have to be able to track those, and they have to be going down. And we could get into the esoterics of trajectory, but it has to be over 14 days. And then the number of tests, the cases, have to be going down as well, but that's dependent on how much you're testing. And then finally, hospitals have to be ready. And they're kind of vague on that. So I think that if you evaluate different states, some states are probably close to that today, others are not. And that's going to be the real driver, because you got to pass that gate to get into the phases. One thing I would say is that doing elective surgeries is something we shouldn't have stopped in some places. Imagine this same plan about a month ago, where we said, hey, if you have enough hospital beds, if you have enough protective equipment, and the prevalence in your community of COVID is low, let's go ahead and continue some of these elective surgeries. We're closing hospitals now because they've lost 50, 70% of their revenue based on these surgeries. So that's something I'm really happy that they're liberalizing in this.
Now, the question, of course, is when states will start actually following this. Will it be the end of the month, April 30th, which is the administration's target date, or could it be later? Is it going to be state by state determined? I mean, clearly that's going to be the case because every state has the onus on them to make that determination, as should be the case. But how widespread do you think it will be for states to be able to take that phase one first step?
Well, I think something is really important is antibody testing. I saw the first antibody data, I just retweeted it, out of Santa Clara, California. And you should look at that. And what they found was the prevalence was up to 4% of the population, which would have meant 81,000 cases, which is about 85 times greater than the cases they have today. So what does that mean? It's what we've known. There is more of this than we know. There's more immunity than we know. And so I think an important thing is understanding which states have that prevalence that's higher, which states have the testing capacity. So antibodies and PCR, or testing for the virus, both have to be in place. And I think once you test the water with that, we're going to learn a lot more. In Boston, 30% of the homeless population they tested was positive and asymptomatic. So I think if you look at the Iceland data, they tested 10% of the entire country, and half of the patients that had it were asymptomatic. So that's something that we're going to find.
Dr. Dennis Deruelle, our guest here on Jimmy at the Crossroads. So one of the things that's really helped doctors to be able to carry out their practices in the midst of this crisis has been the use of telemedicine. I mean, it's been incredible to see technology making it possible for doctors to treat patients at home. And we want people to be at home as much as possible during this pandemic, to be sure. So let me ask you where you think the current state of play is for telemedicine, and how big of a role could this play, particularly in phases 1 and 2, and even beyond? And are there legal fixes you think need to be done in various states across the country in order to make it more plausible to implement on a wider scale?
Well, I think what we've learned, we've known for 20 years that telemedicine is effective. It's just that Medicare has been very slow to reimburse it. And obviously that was the catalyst. If one thing COVID did, it was a catalyst to really change and accelerate how Medicare has deregulated this industry. I mean, they literally said you don't need a HIPAA-compliant platform. That is our protective law against privacy. They said you could use a regular phone now. And so once we've done this, the genie's out of the bottle. And we've been using it in my practice. I'm over doctors in 19 states, 2,000 doctors. We've already been using it, and now it's going to be hard to go backwards. So I think that it's been instrumental. However, I want to say one thing. If you're having a heart attack, you can't do that and treat that via telemedicine. And unfortunately, the problem that we had was we said lockdown, and patients heard that, and then they're staying home. We've noticed heart attacks, serious heart attacks, are down 40, 50% in some of the emergency rooms, and we know they're still having them. So my one message out to everyone is, please, if you're having a stroke, if you're having a heart attack, can't treat that with telemedicine. We have ways to treat that very quickly, and time is of the essence. So I want to get that message out.
Yeah, I think it's so important to stress that point, Dr. Deruelle, because we've seen reports of people staying at home and having heart attacks and other heart issues that flare up, and yet they don't go to the ER to seek medical attention.
Absolutely. I talked to a cardiologist the other day, and she said that a patient had chest pain, thought it was COVID, and didn't come in, was afraid to come in. 4 days later, now his heart function will never be the same, and he had a chance to really save some of that precious heart. I also talked to one of my colleagues, a doctor, the other day, and a patient came in, had stroke symptoms, but it was 4 days later. If they had come in that same day, we have treatments and clot busters that we can use if you come in. And then finally, on Twitter, I saw a case of a cardiologist that had a ruptured ventricle. So that's something, we never see that septum rupture typically in heart attacks unless it's really late. And that's something that could have been prevented. So please, to everyone out there, you're not safer at home if you have something that needs to be treated. And by the way, half the ERs are empty anyway. So, you're going to be okay.
Again, we're talking with Dr. Dennis Deruelle, who's a physician and practicing hospitalist, also author of the book, Your Healthcare Playbook, Winning the Game of Modern Medicine. Dr. Deruelle, when we talk about reopening America, obviously there are a lot of different things that the Trump administration wants states and people across the country to keep in mind, maintaining social distancing, slowly moving more and more into larger crowds and what have you. What do you think are the criteria that a state should be looking at? And of course, the administration's put some of this forward, and perhaps you can point to them in your answer, but that states should be keeping in mind when they feel comfortable and ready in their own territories to start opening things up from a medical standpoint, a healthcare standpoint.
Yeah, that's a great question. There's something called in epidemiology an R naught, which is really how many people, if I have coronavirus, can I infect or would I infect? And we've seen the R naught for this virus, it's very infectious, to be about 3, 3.5, or 4. That means if I have it, I'm going to give it to 3 people. Those 3 people give it to 3, and that's the exponential growth. So a lot of people are saying we need an R naught of 1, less than 1. And I just read that New York is now approaching that R naught of 1. And I know that in Tennessee, I live in Nashville, we have some of our areas of the state that are less than 1 for that, and some that are still up in the 2.5. And I'm surprised that the criteria didn't involve that statistic.
That's an interesting observation, Dr. Deruelle. So in terms of the social distancing aspect of this, I mean, obviously talking a lot here about phase 1, but when we get to phase 2 and phase 3, it will take time for us to get to a point where people will even feel comfortable going out into the public, but also for governments to say, sure, you can go ahead and crowds of 50, 150, 200, fill up a concert hall. How long do you think social distancing may last in some of these really strict guidelines?
Well, it's really funny. I just tweeted something that, this plan won't really drive what people do. The people will drive the plan, and they'll kind of self-correct. I mean, almost like a market. If people are afraid and they don't have the confidence, it doesn't matter if you open a bar or you reopen a stadium. And so, to me, the confidence has to be there, and in a way, it's gonna drive what we do.
So, Dr. Deruelle, when we look at confidence in this question, I think you're so right that people will make the decision themselves if they want to go out into public, whether governments opened it up or not. And that's why I think some of these restrictions can more easily, more quickly roll back, because people will take it upon themselves to make a decision. Do I feel comfortable going into the crowd? Do I want to go to this restaurant again? And so I don't think government will have to be too stringent for too long, because people are going to be smart for their own health concerns, I think.
Oh, absolutely. We've seen that patients have this propensity now to stay at home, even with really dire circumstances. So you've got to put that in perspective. And so, I think we'll self-regulate a lot of that. But you've got a couple of things that will also drive confidence. Number one, we're treating right now across my practices, we're treating about maybe 80 patients a day right now. And I'm tracking all the treatments that we're doing. I'm tracking all the outcomes. And as soon as we have something that is proven effective, that's going to be a big game changer. Number two, when we have a vaccine, so the things that'll drive confidence are when the cases are going down, when hospitalizations are going down, and when we have a treatment, a better treatment or a proven treatment, and when we have a vaccine. So I think, when you talk about what confidence is, those are the things that I think the Americans will judge confidence on.
Let's talk about two things that people have been discussing quite a bit. One is hydroxychloroquine, and of course this potential treatment. Many doctors have been making the decision to prescribe it. Some politicians have said, no, we don't want you to, trying to block physicians from making that decision and in essence getting in the way of the doctor-patient relationship. We spent a lot of time talking about the legal ideas associated with Food and Drug Administration and governors and so forth relative to drugs like hydroxychloroquine. But also you mentioned earlier about antibody testing. So can you talk to us about both of those and the potential role you see as maybe helping to move along this process of reopening America, Dr. Deruelle?
Absolutely. Well, as far as I'm concerned, the best drug out there is remdesivir. There was just another study. It wasn't a study. It was a case series out of University of Chicago, 125 patients. Only 2 patients died. And these were pretty severe patients. So I like the drug remdesivir. There was also a 53-patient series that was in New England Journal last Friday that also showed very good benefits. However, it's hard to get. It's still only expanded access. So if I had to pick a drug today, that's the one I would want. However, you asked about hydroxychloroquine or Plaquenil, and the data on that is not that great. In fact, the most recent and the only randomized trial that came out of China showed that it wasn't beneficial in reducing the viral load. People got better symptomatically a little earlier. And then if you look at all the other studies for hydroxychloroquine, there's a good one in China, there's a good one in France, and a bad one. So when I look at all that data, I think that all we can do is wait for the data out of New York. Those are going to have many more patients, and we're going to see. My gut feeling is hydroxychloroquine is not going to be as effective as we think. However, almost every patient that we're treating in the hospital is on it, because as doctors say, why would you not treat someone with it with a very low risk profile in the worst pandemic if we find out that it does work? So that's just my take.
How about antibody testing? Expand on that a little bit.
Oh, well, antibody testing is going to be huge. When we get an infection, we have 2 antibodies, IgM and IgG. IgM means we have the infection now. IgG comes later. It means we had it. And so when someone is positive for IgG, and their IgM is negative, that means they've already had it, and we didn't even know it. As I mentioned, many people we're going to find, I think, have had this. Different populations up to 20-30%, other populations about 4%. And so now the antibody doesn't mean you're immune, but the good news is that this virus has not mutated very much. So when you look at the virus from China and from Europe, the one protein, the spike that lets it get in cells, seems to be pretty constant right now. And that means that it's a better chance that if you have an antibody, it's going to be able to fight it. If the virus was mutating a lot, which it's not, then an antibody might not protect you.
Dr. Dennis Deruelle, our guest here on Jimmy at the Crossroads. Just a couple minutes left, and I'm curious. I want to play cut 3. This is Dr. Birx at the White House yesterday at the Coronavirus Task Force press conference talking about phase 2, which would be the next step in the process to reopen America. And we won't get into phase 3 per se, but I want to play phase 2 and see what you make of that and how quickly you think we might be able to get to that point, Dr. Deruelle.
Again, we're asking for the public to continue to maximize physical distance. However, we increased social settings to be able to now have 50 individuals, and non-essential travel can resume. Next slide. This is for the employers. We still would like to encourage telework, and the common areas should remain closed or be physically distanced. All non-essential travel for employees can resume. And then again, special accommodations for vulnerable. Next slide. This should be a relief to many of households that have small children. Schools, daycares, and camps can reopen in phase 2. Visits to senior living facilities, however, should remain and hospitals prohibited. Large venues can operate, but solely under moderate physical distancing, and elective surgeries can resume on an outpatient and inpatient basis.
I would say, Dr. Dennis Deruelle, that phase 2 is more the point where America starts to feel a little bit more like we're getting back to a pseudo sort of normal. There are some things in there that allow for more crowds, more gatherings, venues to open up, things along those lines. When do you think we might be able to get to that point, and what really needs to happen to get to phase 2?
Well, again, we're going to need confidence from the public. I think it's interesting when they talk about high-risk individuals. Let's realize that if you're obese, if you have hypertension, if you have cardiovascular disease or diabetes, do you know how many patients in America that are under 65 that have those? So, I mean, I think it's kind of interesting. That's almost 40% of the population or more. And they're supposed to still be, isolating at that time. So I think what's going to be interesting to me is how many people disregard that because they feel safe. But to answer your question, I think that that by August we should be in this phase, if not a little bit sooner than that.
And Dr. Dennis Deruelle, anything else you think the American people really need to know about the 3-phase process and how quickly we might get back to normal, as we say? Anything we should be keeping in mind?
Yeah, well, my message to my mom, and I advised her on February 25th about to stay inside. She's a high-risk population, same with my dad. And so I think the biggest message is really if you're in a high-risk population, you really got to watch these things. And also be careful. Just because you're high risk and you stay inside, if you have a family member that goes out and comes back, then you have to be very careful. And really, face masks in public, there was a great study in Nature that looked at how it's protective. And so it's protecting the projection of aerosols and droplets. So I think good hand washing, face masks, and high-risk populations really need to be most conservative in these measures.
Dr. Dennis Deruelle, MD, FHM, author of Your Healthcare Playbook, Winning the Game of Modern Medicine. So great to talk with you. Very insightful. Let's definitely have you back here on Jimmy at the Crossroads.
Anytime. Thanks a lot, Jimmy. Be safe.
You too. Have a great weekend as well.
Thanks.
Once again, Dr. Dennis Deruelle joining us here on Jimmy at the Crossroads. Such a pleasure and a privilege to be with you. Abbreviated show, but just some final thoughts before we wrap up here on the show. First, I think that it's good that the Trump administration has put forward a 3-phase plan, working our way to reopening things fully, to getting back to normal. Providing these guidelines to the states, very good. And I'm glad that they're doing this. But of course, the onus is indeed on the states. They need to take the initiative. It is on the states to make their own decisions for their own territories. I certainly hope my home state of Colorado, by April 26th, as Governor Jared Polis here has said his target date, that the state government in Colorado, open up then and not any later. Because this isn't something that needs to be delayed in Colorado and in many states around the country. We need to get things rolling again, but you need to do it smartly, and I think it's very good that the Trump administration decided to take these steps. That is it for us today on an abbreviated edition of Jimmy at the Crossroads, but we will be back Monday, same time, same place, for more engaging, intelligent talk, Sang style, in partnership with the Washington Examiner. I will also be on tomorrow night on Denver's News Talk 710 KNUS. Be sure to tune in 5 to 8 p.m. Mountain, 7 to 10 Eastern Time at 710KNUS.com. Next week, we're working up some phenomenal guests and great programs for Jimmy at the Crossroads, so don't miss a beat. Have a great weekend. Stay healthy. Stay safe. We will get through this. We will open again. We will be America again. Well, we are America, but it will feel like America again. And by the way, God bless America.